Well, good afternoon, everybody. We're here to discuss investing in health for a more prosperous future. And of course, that discussion is linked very much to many of the other issues that have been discussed here at this conference. How do we define well-being? How do we work together across agencies and across government? How do we consider agency in all this context? And it is interesting, if some of you listened to the keynote speech earlier on, that we heard that there has not been enough progress to move forward. And I know those of us in health do always have the feeling that there is not enough investment in health. And there's probably sometimes also the wrong investment in health. And that is something we'd like to explore together. I'd like to introduce my panel. I have with me to my left Chikwe Ihekweazu. He is Assistant Director General for Surveillance and Health Emergency Intelligence at the World Health Organization, and is also here in Berlin as the Director of the WHO Hub on Pandemic and Epidemic Intelligence. Then we have Heinrich Meusser, who is President and Managing Director of Novartis here in Germany, Rachel Silverman-Bonifield, who's Senior Fellow at the Center for Global Development, and Hatice Betong, who's the Executive Director of the G20 Health and Development Partnership. So together we're going to have hopefully a lively debate. People have been asked not to prepare opening statements, so maybe that will make it exciting for you to spend the next 45 minutes with us. So let's start with outcomes and investment. Rachel, the organization you work with is continuously trying to measure how are we progressing, and also trying to look particularly people, our governments, are the big donors investing in the right field. And can you share some of those data with us, and also some of the concerns you get, particularly looking back at the last 2-3 years of the pandemic?
Absolutely. Thank you very much for that introduction. So one thing that I would say concerns me is that I think in global health, we still do not have a sufficiently robust evaluation function. I think that we do a pretty good job of collecting data to track things in a longitudinal perspective, to say, are things getting better? Are things getting worse writ large? But that's a very different question from, okay, are the specific interventions that we are funding, for example, through GAVI, the Vaccine Alliance, or the Global Fund to Fight AIDS, tuberculosis, and malaria, are those having the impacts we want to see on actually reducing the burden of those diseases over time? And I would argue it's not enough to just say that in a longitudinal perspective, the burden's going down. Every day that there is someone dying from malaria or AIDS or tuberculosis, that is a failure to the extent that we could have prevented it. So what I would love to see is a focus of going beyond just monitoring and tracking into this more robust evaluation function, where we really take seriously the responsibility that every dollar, we do not get enough investment in health, but if anything, that puts the pressure on us even more so to make sure every dollar is spent as well as it possibly could be towards the ends that we're entrusted as stewards of that money to accomplish.
Where do you see the greatest gap, if you say, put the dollar where it's really needed?
Well, there's a few things I would say. So one is that there's always a mismatch between prevention and treatment. And in some ways, this is totally understandable. You see a patient before you who desperately needs a drug to survive. Of course, you cannot deny that person the treatment they need. And that will always, in a certain psychological sense, take precedence over the prevention and preparedness expenditure. But if we look about where the opportunities are for the biggest impact, a lot of times it's further up the chain. It's these early interventions around the environmental and social determinants of health. It's basic preventative care like vaccination. And I think that we, in most settings, have a bias towards curative care versus preventative care. And probably there is a reallocation needed there in the big picture.
Thank you. That's your area, Chikwe. So, and definitely what's the message WHO is trying to give now. Recently, the Director General has made a strong statement where he said health is not created in hospitals, It's created in cities, shops, playgrounds. He's trying to refer to the many determinants of health. And of course, also to the big issue of equity. So if I turn to you, if you look at where the money is going right now, particularly also keeping a bit of the pandemic in mind, where is it not going? Where should it go? Where is the greatest gap?
Thanks, Ilona. And, thanks for having me here. I think, firstly, to say we're in an absolutely privileged position in the last 20 years, seeing the increased investment in global health altogether, the emergence of the Gates Foundation, GAVI, Global Fund. In its totality, it has brought an incredible amount of money absolutely into the sector. But just building on what Rachel said, I think if you measure the single goals of each of these programs, whether it's on HIV, TB, malaria, I think you will see a lot of improvement. I think where the gaps are the intersections. Because each of these endeavors are building towards a single target. But those things that bind them together, the institutions, the primary healthcare, all the things in the middle that you need to build in order to then deliver on disease-specific outcomes have kind of fallen through the cracks. And so, yes, we may achieve a reduction in HIV from X to Y, but if the laboratory infrastructure that we have built for HIV is not able to serve everything else, including when we have new viruses of pandemic potential, then we have to ask ourselves very hard questions. Are we sufficiently leveraging the absolute inflow of finances to get the best benefit for our societies? So I think that in addition to the absolute amounts, there's been a great inefficiency in the spend. And the onus is on us really to start by readdressing some of that. So before I actually push for more money, I look internally to say, how can we better use the resources that we have? And that's a reallocation of resources that is very much at the top of the DG's agenda at the moment.
Thank you, Chikwe. And we've seen that also in the multi-stakeholder discussions just last week at the United Nations, where the preparations are underway for a big summit on universal health coverage, a high-level meeting in September, a so-called pandemic summit, and also a specific disease area, again, tuberculosis. And the message seems to be over the last 20 years, if not longer, we have not invested in universal health coverage. We've even had too narrow an understanding of universal health coverage because we have not really included public health, to our detriment during the pandemic. And of course, with the pandemic, we are starting to see this cycle of panic and neglect again. Hatice, you're very involved in the G20 meetings. We met in Goa also just 2 weeks ago. Would you say something about the G20 awareness of where money and investment should go? I mean, they've created this joint meeting of health and finance ministers. Is anything changing there, or are we just continuing to do the same old stuff?
Thank you, Ilona. Yeah, indeed, I join my former panelists in their arguments. But what I would like to say is in the G20 discussions that I lately observe, and I've been in this field for now 7.5 years, trying to bridge the disconnect between the global health community, G20 health and finance ministers, to make the case why we need to have structured investment. What I observed is, finally, we're sitting here together. We don't have to prove why health is a positive investment into socioeconomic growth and other sectors. We now acknowledge that after the pandemic, so that's step number one. But now that we're sitting here, I really welcome that we discuss what concrete solutions and investment opportunities, public, private, institutional, can we drive forward to close this funding gap that is ever increasing in health. So to your point, Ilona, on the G20 discussions, the Joint Health and Finance Task Force, as we speak, has published a statement a few weeks ago where they, for the first time, when I spoke to the health ministries, they said to me, bringing health and finance ministries together since 2.5 years in a task force platform in the G20 really helps the health ministries to have a structured dialogue with the finance ministries that they never had before, because they understand how finance ministries allocate budgets. What do they need as a political rationale to unlock further funds from health ministries? And this is where your point comes, Chikwe, where you said, it's not only about putting money behind HIV, AMR, or others, it's the interlinkages. And if you can tell the impact story and how your investment leads to socioeconomic growth, employability, education, then you can come to a different systematic thinking approach. And on the last point, yesterday the G7, in a joint declaration between health and finance ministries, have for the first time said, we need to move beyond accepting health as an investment and structurally think about how we restructure the global health architecture. And for that, we need to look at new solutions and don't do the same old of creating a plethora of funds or new initiatives and new communiques. I think that time is over.
Well, they just did it. At least the G20 did it and created a pandemic fund. Yeah. And we saw at the board meeting of the Global Fund for AIDS, Tuberculosis and Malaria that they said, it's not clear to us how we should interact with this fund. And obviously, the more you invest in new organizations, the more you need to invest in collaborative infrastructures, in comparative measurements, who's most effective. And if I can just ask one more thing, because you indicated it, ministries of health have now, let's say for 10, 15 years, been arguing about investing in health. And all the special programs do that as well. So the finance ministers get one investment case after the other thrown at them. If you invest in TB, this is what happens. If you invest in malaria, that's what you're going to save. So how does one make that investment case better? What are you learning there, Hatice?
Okay, so first of all, no health minister, to my knowledge, has ever lost an election by investing into health. So from a political perspective, it's always positive, and you can make the case, why this is important. What I've learned, Ilona, in how you make this whole package and build the narrative is that you, for example, if I'm a health minister and I speak to a finance minister, I need to be able to say, look, finance minister, these are the gaps in my health system and in these specific programs on, let's say, cardiovascular diseases, diabetes, infectious diseases. And I need to first tell the finance minister how the investment of the finance minister contributes to the overall economy in that country. So how does the entire value chain of health in an economy contribute to the overall economy so that the finance minister sees the value of investment? In Germany alone, 11% of the health economy contributes to the overall economy, as an institute called the WIFO Institute has acknowledged. However, the second step, to your point, is once you assess these gaps and show the value, then you can say to the finance minister, look, these are the other areas where there's investment lacking. So I propose to develop X, Y, and Z program, let's say tackle diabetes by 30% in the next 5 years. And I need X investment from you, finance minister, because it will increase employability in certain sectors. It will, enhance, strengthen economies, and also bring back talent, right? So bring innovation into the country because people will do more research on tackling diabetes, for example. So you need to tell the overall argument and show what the value has been so far to further unlock funding. If you just say, I want money for malaria or HIV, well, we have a war going on around the world, a food security crisis. The finance minister has so many other issues to deal with. So you need to create the linkages as well.
Heinrich, let's go beyond finance ministers. Yes. Germany has a minister for the economy. And actually, that ministry has a section on the health industry. And we all know, and you sort of alluded to it, how important the health industry is in many countries. I understand in Germany it's larger than the car industry. So I think it would be interesting, Heinrich, to hear from you how the health industry, in your case, obviously a company in the pharmaceutical sector, sees its contribution in that larger picture of the economy of a society, of the workplaces created, and then maybe the next step, how it sees that responsibility also reflected in a larger cross-border responsibility. So the value you are creating within a country, but do you also think about the value created elsewhere? Because what we are discussing here is it's not just about profits. That's what everyone's saying. How does that work at Novartis?
Oh, that's a loaded question. Thank you for that. But I like it, how you framed it, because it's the together. What's your part in this? And maybe allow me just one quick comment. I think that's really the way I think we have to, and I'm thinking about it together. And if you look at the last centuries of humankind, if you just looked at how we are bending this life expectancy, these life curves, right? So 150 years ago, the average expectancy was about 35 years. In Germany now we are 80. And what is interesting, fascinating, and I think rewarding is that the life expectancy doubled in all the countries, not only high income, also mid-income and low-income countries. And I think we can only do that together with better safety, health, prevention, infrastructure, medicine, but everything together. It's also great to hear that finally this link between economy, so health and wealth, is seen. And so we as Novartis think about it as we are part of the system and we contribute with what we can do best. So you asked me basically two questions. One is about the economic impact. Let me go there first. So in Germany, we're not bigger than the car industry yet, but we created more jobs in the last decade. And I think this is huge for Germany, the whole health industry. And what we see here is the wealth of the nation is increased. Also, the health industry is a knowledge industry. It has big spillover effect on other industries and makes basically Germany stronger. It's the same technology. We use artificial intelligence, computing, and it strengthens the country, the GDP of the country, and therefore the social system of the country. So it creates jobs. About 1 million jobs in Germany are attributed to the health industry, and therefore the social systems. So for me, it's also a question of justice. The other question you asked is, what is Novartis' role in this? So the question is, what do we do best? And how do we marry that with where the need is the biggest? And that's a little bit our approach. What do we do best? We do research and development best. Developing innovative medicine, distributing them, taking entrepreneurial risks. Many of them also don't work out. Actually, out of 10,000 compounds we develop in the lab, only one makes it to the market. But that's what we do best. And then the question is, where is the need of a society? Where is the biggest economic burden from diseases? And that depends on country by country. The interesting part is if we improve or reduce the burden of disease, we can improve the economies of all the countries, high-income countries as low-income countries. So for instance, in Europe, cardiovascular disease, you just mentioned it, is a huge topic. Probably it's estimated that it costs us 4 to 5% percentage points of GDP growth if we would address cardiovascular disease. How do we partner with systems in Europe here? For instance, an example from the UK where we see how we partner with the systems, but also how technology plays an increasingly important role. In the UK, 40% of the people have elevated cholesterols, and the challenges to prevent heart disease so that the disease doesn't progress, because if it progresses, then you get into an intensive hospital care unit, you have heart events and so on. And what is interesting in the UK is that the NHS has data capabilities to identify those patients. And so we partner with them to keep basically those patients preventively safe and healthy at their GPs to prevent secondary progression. And therefore, tap into those benefits, not only for the health, but also for the wealth. As I said, 4 to 5% of GDP growth in Europe is costed by cardiovascular disease.
Thank you, but there's sort of two sides to the picture, and I'd like to get to you on that, Chikwe, because on the one hand, we do have an industry that contributes to health and well-being in a variety of ways. You've mentioned some of them. We do obviously also have an industry that contributes to ill health quite considerably. And it's interesting to note that within the stakeholder sector of industry, one side maybe that produces the diabetes drugs doesn't say too much about the side that's in the industry that actually helps to create diabetes. So there are these two sides of the sector, one sector with an enormous externality and health costs, and another sector that is able to grow actually on exactly those health costs. So how does one address this in terms of investments, regulations, policy approaches, dialogues, as you've said? Chikwe, give us some guidance.
I think, if you look at the progress made in whether we call it the global north or a Western society around healthcare, I think we have a lot to be incredibly proud of. And I think the internal incentives for continuous improvement driven by research, by science, by political demand will keep pushing life expectancy even further and keep improving the quality of individual health, especially related to chronic diseases. But, this is a conference for global solutions. And if there's one thing we've learned from this pandemic is we don't live within the boundaries of our political establishment. And especially when it comes to infectious diseases and many other threats, it's not enough to have great life expectancy in Germany and be part of the world. And for many of these global problems, we have to accept that maybe investing in the other extreme of the world is actually what will protect us here. And the same relates to many other countries. And that's a politically difficult argument to make, that we need to take a fair bit of our investments and invest them in building laboratory infrastructure or whatever in another country, in not out of charity, but in our own selfish best interest to survive as a society here. And these are very difficult political arguments to make. But if we don't learn anything from this pandemic, it should be that whether we have great industry or great science or enough citizen activism to invest in health in our countries here, it is still not enough. Because to actually survive, we have to find the incentives to lead us to thinking about ourselves as a global community. And that's really the point the DG of WHO, Dr. Tedros, tries to make all the time and shouts about equity. And people get almost tired of hearing that word. But it's so important that we change the framing of the conversations we're having to fit into the global community in which we live.
Thank you, Chikwe, and thank you for taking up that important component that also many of your colleagues and you work on, Rachel, and that is to move out of the charity model of global health, that we do need to see the financial flows in very different ways, that we need to see the economic impact in different ways, and therefore also automatically what we consider investments. But that somehow is starting to get in the way also of some of the geopolitical discussions, because it seems to me, and I'd like your view on that, that, you mentioned the investment in research, for example, in innovation, in technology, that this in itself is becoming a competition between countries rather than coming together in the sense of a global good that reduces the big equity challenges. Do you see that happening?
Absolutely, and you saw it everywhere during the pandemic. It was obvious. I mean, much has been written and spoken about the idea of vaccine diplomacy, or you share your countermeasures with your allies or someone you hope will become your ally, and it's these strategic measures. I mean, you also saw during the pandemic strategic groupings together around creating countermeasures, but also within a context that there is a undercurrent of a strategic goal. So, for example, the Quad partnership to increase voluntary licensing and vaccine manufacturing in India, that was good on its own terms, but you could, of course, see the geopolitical subtext to what they were trying to do at the same point. I think trying to eliminate that sort of dynamic is a bit of a fool's errand. There are geopolitics, and I think we see, just in, say, the costs of the Ukraine-Russia war for both parties, that those geopolitical interests are going to outweigh a lot of even very strong arguments about what our collective interest is. So I think it's our task to figure out how we work within that, how we channel the geopolitics in a constructive direction, how we use moments like, say, the competition between the United States and China to increase vaccine manufacturing in India. Yes, there's a subtext, but it's a good thing in its own right. So how can we work within the actual geopolitical context we have? How can we be realists in the world as it is, warts and all, and think about the good things we can do that are compatible with countries' geopolitical interests versus trying to swim upstream of them, because I think that really is a dead end, and we will exert a lot of energy and end up in exactly the same place.
So Heinrich, if I can come to you on this, of course, your industry, particularly pharmaceutical industry, is one of the most heavily attacked and criticized during the pandemic. And at the same time now, following through from the pandemic, one is trying to say, we need different approaches. We need more innovation. We need more expertise. We need more knowledge. We need more production in the countries of the Global South. We need more knowledge sharing, which also brings in the tough question of intellectual property. We need to look, obviously, and Chikwe referred to it, not only look at medicines or vaccines, we need to look at a whole wide range of technology. Diagnostics is often severely undervalued. So from the perspective of your industry, did this get you thinking what happened during the pandemic, the attacks that you had from various sides about really contributing to what the Director General of Health called vaccine apartheid? So how does one address that, and how can an industry like yours actually gain trust?
So especially the pandemic was a highly dynamic situation, which I think also brought the best out of many people and the players. But it also raised many questions, right? Because what we have seen in the pandemic is also pandemic worldwide we can only solve together. There's not a single party, there's not a single player who can fix it for all. So we need to sit together in a dialogue and in collaboration and see how we can do it. And I think the basic question we're struggling with is how can we ensure innovation and broad distribution, broad adaptation at the same time. And that is a little bit of a conflict we all are struggling with. Because if you look at the innovation part and the investment part, it comes with a high risk. It comes with high investments, high risk. I mentioned before, from 10,000 drugs that we develop in the lab, only one makes it to the market. And I think the pandemic was a great example for that. If you think about the two most commonly used vaccines, or two of the most commonly used vaccines from BioNTech, Pfizer, and from Moderna, these were outliers. These were two NASDAQ-listed biotech companies, probably not profitable before the pandemic, like 85% of the companies listed on NASDAQ. And what we needed here was a competition of ideas, of different ideas, and availability of those ideas suddenly made a breakthrough in the pandemic. So how can we have investments come in? How can we have this diversity of ideas come in? How can we have these high-risk ideas come in while securing equity and distribution? And what we know is we need incentives for these investments to come. That is the incentives and the investments go hand in hand together. And I think that's what we learned also over the years. But then we need to sit together like we did in the pandemic and see how can we solve it. And there are multiple solutions possible through licensing. We also had Novartis experiment with that, for instance, through the Atom Coalition. That is in cancer vaccines, in cancer medicines, where we contribute drugs that are still on patent to the Atom Coalition for sub-licensing. And I think we need also to think in those terms. But, and I know it's not popular, we need incentives for R&D, because if we don't have it, there's no innovation coming out, and then everybody's losing.
Thank you. Chikwe, how is WHO dealing with this? There's obviously negotiations for a pandemic accord or treaty, as some call it. There's also a strengthening within the organization on this whole area of science and innovation. I'm thinking of the chief scientist of the World Health Organization. So what are the signals we are getting from this key health organization that we have to be able to be better prepared and to have a different kind of interface between these investments in the private sector, between sharing knowledge and technology, and also new rules of the game, maybe?
Yeah, thanks, Ilona. I think this is it's not really just for WHO to solve. It's really a global challenge, right? We've built great societies out of the principles in a way of competition, right? Like you say, just 1 out of 10,000 substances make it into production. And, all our industries have driven out of a survival of the fittest in a way. But also we forget that some of the great principles that this society is based on is on solidarity. We built a health sector in Germany out of solidarity. We accepted some weaknesses in society that we have to come collectively to resolve. And I think the challenge we face in the world is that we have to find a principle of collaboration and solidarity in a global space where there's no global government to enforce it, outside of organizations like WHO that are kind of member state-driven voluntary organizations to a large extent. So we do have a fundamental challenge. And so WHO is really pushing hard on many fronts, on the science front, on developing new countermeasure platforms so that we are not reinventing COVAX in the middle of another crisis, that we think of how do we negotiate some of these things beforehand so that the process from when there's another crisis, from the ideation to production, is a lot shorter than it was this time. But underlying all of that has to be a change in mind, how we think about these things, which is a political choice really for our leaders to make. And that's where Germany's role has been very important in the last few years, not only driving its national objectives, but really being at the heart of multilateralism as a strategic, in its own strategic best interest. So I think the more countries that find it important to agree on a multilateral agenda for the world through organizations like WHO, all we are is a secretariat for our member states. So the more we get the political backing by our leaders, the more we are in a stronger position to drive this change for the world.
And
please,
if I may add, because I agree with this approach, we all need to ask ourselves what's our role in this, and the responsibility and the values. I think if we are clear about our goals, we can make progress. And then we find solutions. In the pandemic, we opened up our research databases to each other, production sites. There are also many approaches in the industry, also from Novartis, on donations, on partnering with healthcare systems and building them up. They're very individual. Sub-Saharan Africa is very different than maybe now North America. There are different needs. But I think it's about those principles, and then we can make a contribution.
Thank you. Rachel, there's been regularly the discussion, and I'm following up also from what Chikwe said, in terms of let's invest in global public goods. I was talking to somebody yesterday and he said, forget it, forget global public goods now because of geopolitics and everything else. Is that what you think, or do you think there can be defined public goods that we systematically invest in? And of course, then do need to find the mechanism to make that investment. But how do you discuss that in your work?
Public goods are interesting because they are one of these I mean, it's sort of an economics concept, right? Of that we are all contributing to something that is non-excludable. And so there's all sorts of incentive problems of why should any one individual contribute to this? It's a great coordination problem. It only sort of works if everyone comes together to do it all at once, but you can have free riders on the other side. I think that in this context, probably global public goods in a context where we all have to agree and sign a treaty to make them happen, that's probably not the way forward. But for better or worse, we still have quite a lot of economic power concentration in a few countries. If we think about sort of where the GDP of the world is concentrated or the total tax revenue, government revenue that could be put towards things, we're really only talking about, within the G20, let's say, I think I saw it's 85% of the world's GDP. You don't need everybody to come together to get to a global public good. You need critical mass of people who are willing to say, you know what, this is good enough for me and my citizens that I'm okay if, me and my partners fund all of it, and we're only 40% of the world, and everyone else free rides. And we still will have the global public good, we'll still benefit. I think if you wait around for everyone to get on board and pay their fair share, you just never move forward. And so the question is for governments, is this valuable to us? Is this global public good something we all actually want? How valuable is it to us? And can we find a few partners to come together and fund it? I am skeptical or a little bit cynical about the treaty approach in the current environment or anything that's sort of based on firm obligation. I think it has to be more opportunistic and built around kind of smaller strategic partnerships.
Thanks. Hatice, what do you think moving around in the G20? I mean, it's totally new for us that the G20 plays such an important role in setting the health agenda, in activating money, etc. Are we happy they're doing that? Do we want more of these kind of clubs? Do they have the legitimacy they should have? Should they work in new ways with WHO that has everyone there?
I think we don't need more clubs because we have a plethora of clubs around the world. I think we need to strengthen what we have. And obviously, whatever we do on health policies, the WHO has to be at the center because they represent the entire world. So we can't disenfranchise the WHO from policy making. The G20, from a geopolitical point, coming to your point, Rachel, is so we are at two crossroads. On a positive note that you highlighted, when I look at the social bond market, pre-pandemic and during the pandemic, you can see a tenfold increase from 2019 to the end of 2020 in the social bond market globally. And that shows that investors and asset managers clearly realize that there is a value that health is impacting. Basically fixed income markets, equity, and obviously economic growth. So the appetite of coming together in investing actually was there. In that regard, I see health diplomacy actually as a peacemaking tool in these challenging times. So coming to your point before, Chikwi, you mentioned political will. So we have all of these investors who have invested into social determinants that have underlying health issues. But on the other hand, we have the political will issue. So health is not just a charity. 40% of the world's debt is owned basically by China. They distribute the world's debt. On the other hand, we have emerging leaders in the G20, which is India, Indonesia, China, and Brazil.
South Africa.
South Africa is another one. So all of these leaders have a new role to play to boost economic growth in the years to come. And what we are seeing in the G20 right now is we have the strong G7 on the one side, but then the other players that I just mentioned. So how do we create new structures and political will amongst these actors to contribute to public good? And the pandemic fund that was created is such a public good that is being developed now. But even if you look at the pandemic fund, and this is where the G20's role is critical going forward, now we have this great, different fund. It's out there. We need 10.5 billion a year. We only have, I think, 700 million unlocked. So yes, we need more money. But how do we make the case of what kind of programs do we support, be it a medical countermeasures platform, for example? How do we support these new projects by including the pharma industry also in these discussions? So what I'm missing at the moment on the G20 table, when we were in Goa recently with you, we talked about the entire creation of a medical countermeasures platform. Everyone was around the table, but not the pharma industry. But these guys will be involved at the end of it as well to help create this measurement platform. So you can't disenfranchise them as well. So bringing back my arguments without getting too much away, is political will is key. And the G20 has realized that responsibility, but now they need to realize the new trends within the G20 and also bringing the other side back to the table. And there's investment appetite. So how do we merge them all together?
Well, thank you very much. That was a big roundup. I think we're nearly at the end of our discussions. I'd just like to highlight 2 or 3 points that all of you raised. First of all, yes, we need investment, but we need investment that is more integrated, that is more equity-oriented, and that also is not donor-driven and moves out of the charity model. I think all of you indicated that. You indicated how important new actors like the G20 are and how they can help also change the mind frame, particularly now that we have 4 middle-income countries running the show, basically, for a couple of years. And we already see that with India and the digital agenda, how things are shifting. We heard from you how important the innovation and the moving forward, also in a constant dialogue with, on the one hand, producers and countries in the global south, but also the need to have a new kind of dialogue, which is again then, and that's what we have not been able to talk about so much, and that is on the one hand we have the global organizations, we have the countries, we have industry, we have a strong civil society voice, obviously. But one group of actors we have engaged less with, and I think this will be critical for the future, and that is the investment community. Because these often set priorities that are not even always totally along the lines of the people running the companies. We know that from some of the consumer companies that actually wanted to move towards more health, but were stopped by their equity investors from doing so. So I think looking in more detail at the financial market in general, if we're really talking investment, that is something which then includes the development banks, the IMF, the debt structuring, and all of these issues. So I hope that when we meet next year at the Global Solutions Summit, we'll have a group like this, we'll have the investment community around the table, and we'll ask them how they intend to invest in health. And that's why we've suggested to the WHO Director General that he should have a chief economist to actually drive this kind of agenda forward. Thank you very much to all of you.
Thank you.
Thank you.